Welcome to another edition of Politics and Right. I'm Egberto, Willies, your host. Thank you so kindly for being with us. Today, we're honored to have Edwin Park. Edwin Park is a researcher, professor at the Georgetown University McCourt School of Public Policy. His work primarily focused on Medicaid, the Children's Health Insurance Program, CHIP, and the Affordable Care Act. And he is considered one of the nation's leading health policy experts on issues related to Medicaid and CHIP financing and the Affordable Care Act's coverage expansions. Among others, he also analyzes tax policies related to healthcare and policies related to drug pricing and private insurance markets. Professor Edwin Park, it's my pleasure to have you on Politics Done Right. How are you doing today?
Good. How are you? Thank you for having me.
Look, I think the work that you are doing here is extremely important. Specifically, and I know this is research, apolitical research, but in the political realm, it is extremely important. Tell us a little bit about the study that you did relative to Medicaid and rural areas.
Sure. We looked at data from the U.S. Census Bureau and compared coverage rates, Medicaid and CHIP coverage rates in rural areas and small towns to Medicaid coverage rates in metropolitan areas. And while it's not widely understood, particularly among the public, that Medicaid is a vital lifeline for those living in rural areas and small towns. And one of the findings is that for kids and non-elderly adults, these are adults under age 65, Medicaid coverage rates were higher than they were in metropolitan areas nationwide. Seniors, it's a little different. It tends to be the case that Medicaid, which picks up nursing home care, help with Medicare premiums and cost sharing, those coverage rates are higher in metropolitan areas than in rural areas. In 29 states, seniors in rural areas are more likely to have Medicaid than those in metro areas. So clearly demonstrates the vital importance of Medicaid in rural areas and small towns, and particularly for rural hospitals and other providers in these communities. Often they're a single provider in these communities. If a large share of their patients are covered by Medicaid, certainly any change to Medicaid could have a dramatic effect on their ability to keep their doors open and provide the services that their rural communities need.
Now, let's get a few things straight for the audience, because a lot of people don't quite understand. First of all, how is Medicare paid for? Medicaid paid for? In other words, what's the mechanism that we have with Medicaid and how it gets to different communities?
So Medicaid is what's called a federal-state financial partnership. So the federal government pays for a portion of Medicaid costs, and states are responsible for the rest. On average, the federal government picks up roughly 60% or so of the costs of Medicaid, but it depends on the kind of groups covered, the kind of services covered. Those matching rates can vary, and it varies by state as well. But it is the case where the federal government pays for the majority of Medicaid costs and states are responsible for the rest. So if federal funding is changed, reduced, that means states are on the hook for picking up the difference and kicking in more of their own funding than compared to what they do now.
Now, as it stands, if I remember correctly, let's bring a little bit of the Medicaid expansion, the Affordable Care Act into the picture. The Affordable Care Act had a piece called the Medicaid expansion to the Affordable Care Act. How does that compare to someone on basic Medicaid?
So the Medicaid expansion was something that was part of the Affordable Care Act. It covers nearly 21 million people today in 40 states, plus the District of Columbia. Under current law, the federal government picks up 90% of the cost of the expansion. So states are only responsible for 1 in 10 of the cost of the expansion, and it's a vital form of coverage for parents and other non-elderly adults, including some people with disabilities who otherwise weren't eligible for Medicaid. They had incomes too high for Medicaid prior to the Affordable Care Act, but too low for coverage through the new Affordable Care Act marketplaces. And this is, a key factor in terms of why non-elderly adults in rural communities tend to be more likely to have Medicaid. It's because of the Medicaid expansion, in large part because of the fact that adults in rural communities have less access to commercial insurance, other sources of coverage, and so the Medicaid expansion was a lifeline for them, their families, as well as to the rural hospitals that serve them.
Now, and let me see if I can qualify this. Traditional Medicaid is a different program than the Medicaid expansion to the Affordable Care Act. Yes, or is that true? Or
no, they're all part of the same Medicaid program. So previous to the Affordable Care Act, Medicaid was primarily about covering children, their parents, seniors, and people with disabilities
below a level.
For parents, their incomes, they were generally covered around 60% of the poverty level prior to the Affordable Care Act. The Medicaid expansion provided a coverage option for parents up to 138% of the federal poverty level, as well as non-elderly, non-disabled adults without kids, and that's what is covering nearly 21 million people. But it's all part of the same Medicaid program. It's just a new coverage group that the Affordable Care Act provided, and it was a huge contributor to the improvements in health coverage nationwide since the Affordable Care Act was enacted.
Now, so the proposed cuts that Republicans are considering for Medicaid, does that mean that it'll affect all of Medicaid, meaning both the Medicaid expansion to the Affordable Care Act and those who are just simply on Medicaid?
Yes. So the Medicaid cut proposals that are currently being considered by House Republicans in particular. There was a document leaked last week that included a list of Medicaid cuts. They include a number of different cuts related to Medicaid financing. Many of them reduce federal funding for state Medicaid programs. One proposal would make it harder for states to finance their share of the cost of Medicaid. But they all have the same effect, which is reducing the amount of funding available for Medicaid. And as a result, states will have no choice but to slash their Medicaid programs in response.
Because it's clear that, I'm sorry, go ahead.
Oh, one of the proposals, for example, would cap federal funding for the entire Medicaid program. So it's not just the Medicaid expansion. And by dramatically reducing federal funding, that means states will be making cuts across the Medicaid program. And so it's not just the expansion. It could be to kids, people with disabilities. It could be seniors in nursing homes. There's a whole host of possible cuts they would have to make, but it'd be across the entire program. One of the proposals is specifically targeted towards the Medicaid expansion, and that would dramatically lower the share of costs picked up by the federal government related to the expansion. That would shift costs to states, and as a result, some states would immediately have to turn off their expansions. Other states would be unable to sustain it over the long run, and as a result, those who gained coverage under the expansion would drop it. But these cuts affect the entire Medicaid program. Kids, their parents, seniors, people with disabilities, other adults, including adults who gain coverage through the expansion, they all would be negatively affected by the kind of draconian cuts that are being considered today.
Now, let me back out of the actual fact-based numbers and just ask you a human question. If they cut Medicare, what are the people who cannot qualify to do? What are they to do?
Oh, so if someone loses their health coverage or their coverage for long-term services and supports, Medicaid, plays such a vital role. It's very likely they will end up uninsured. And we know for a fact that those who are uninsured forego needed care. They have poorer health outcomes. They're more likely to be in a precarious financial state because they have medical debt, unpaid medical bills. And this could have huge negative effects in the short term, but also could have very harmful effects over the long run. Research shows, for example, that Medicaid coverage in childhood leads to better health, less incidence of disability in adulthood, higher educational attainment, finishing high school, going on to college, graduating from college, greater financial stability, higher incomes in adulthood as well. And so the converse is if you're uninsured, if a child who would otherwise have been covered by Medicaid but is uninsured because of the potential cuts that are being considered, they would have poor life outcomes as a result. So their future outcomes would be worse, and societies would be in a poorer state, a worse state as a result, if Medicaid coverage is lost for kids. So it gives you an example about the effects that will have on people's lives if they don't have the health coverage that they do today because of some of these cuts that are being considered.
As a professor, it is imperative that it is expressed in that way. I understand, but simply put, I'd like to tell our audience here, in effect, what these cuts that are being proposed by the new Republican Congress, in effect, will kill. The professor has just stated how, but these things will kill because people will go without health care and they will die. Professor, rural areas are more dependent on both Medicaid and the Medicaid expansion to the Affordable Care Act. Hospitals around the country have been closing because they are dependent on being funded, given that, as you stated, many people in rural areas are dependent on Medicaid and the Medicaid expansion to the Affordable Care. And thus, if they are not seeking care locally, those hospitals close. Are these things that policymakers, through information provided by professors and studies that you have run, are these things getting, first of all, to the people that need to hear it in Congress? And secondly, how much publicity are we ensuring the average American citizen know about this, given that this is something that directly affects your lives? And if it goes through, it's hell getting it back.
Yeah, I think there unfortunately has not been a public debate about the future of Medicaid and what these kind of cuts would mean for everyday Americans, not just including those in rural areas and small towns. There wasn't any discussion of Medicaid in the campaign, in the run-up to the November elections. There have been no public debate about Medicaid cuts since then. And right now, largely behind closed doors, there's discussions of these kind of draconian Medicaid cuts. This was not a factor that was considered by voters, and is largely, passing under the radar. But these cuts would affect the more than 70 million people on the Medicaid program today, including those in rural communities. And it's very, very critical that people understand the value of Medicaid, all the roles Medicaid plays. It covers more than 60% of nursing home residents, 40% of births, about 40% of kids. It is the primary funder of mental health services in the country, the primary funder of treatment for substance use disorders, including opioid addiction. And as a result, these cuts would have a huge impact across the U.S. healthcare system. And so, there should be a full and open debate about the merits of these Medicaid cuts and their likely effect across, a whole host of Americans, those in rural communities and small towns, kids, seniors, people with disabilities, other adults, and that should all be discussed before going ahead with the kind of really massive, damaging cuts that are being proposed that would cause Medicaid programs to be slashed across the country. For example, the cuts being considered total up to $2.3 trillion, according to House Republicans. That's a cut in federal funding of roughly a third over the next 10 years. And it's hard to see how states can compensate for that without having to really gut their Medicaid programs. And that means many fewer people without health coverage, without access to the services they need, including nursing home and other long-term services and supports.
The fact is that states could not recover that money at all. I mean, as it is right now, they are trying to make cuts themselves in healthcare. Now, it seems to me, if we look at the outcomes relative to the OECD, it seems like America shouldn't be cutting Medicaid expansion, but actually increase our Medicaid in general or in the aggregate. It should actually be increasing the amount that it's funded. And we're going in the completely opposite direction, which doubles on the issue. Well, I'm glad that you came on here to point these out. And I usually have one last question that pretty much says the same. What should I have asked you? What do I need to know that I didn't ask you or that our audience need to know?
Medicaid is important form of coverage for so many Americans, and particularly in rural areas and small towns. And any policy change that could adversely affect that coverage will have a huge negative impact. And I hope that people will raise the value of Medicaid, the importance of Medicaid, so that policymakers think twice before going ahead with the kind of really damaging cuts that are being contemplated that could really take away coverage from tens of millions of low-income kids, seniors, people with disabilities, and other adults, including their parents.
Professor Edwin Park, research professor at the Georgetown University McCourt School of Public Policy. Your work is very important. Thank you so kindly for having been on Politics Done Right. This is something that America needs to hear.
Thank you so much for having me.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.